Let's talk about the organ that people are the most confused about. It's your thyroid. I'm Tiffany, I'm a PA, I work in internal medicine, and I get questions every single day because people have a lot of misinformation that they're reading on the internet about their thyroid gland. So let's go over some things that you need to know if you have thyroid disease or suspect that you do. So your thyroid is controlled by your pituitary gland. Your pituitary is literally a pea-sized gland in your brain. Your pituitary gland makes the hormone TSH. And then TSH causes the cells within your thyroid gland to make T4 and T3. So this is what we call a negative feedback loop. So when you get plenty of T4 and T3 levels circulating, your body will send a signal to your pituitary gland to stop the production of TSH. And it'll send that signal and say, okay, time out, stop making it. So it does this consistently and helps your body maintain a steady level if everything's healthy. Now, iodine is a very important part of this. It is what your body uses to make T3 and T4, and it is absorbed through your small bowel. Most of us get plenty of iodine in our diet just by eating regular food. Let's talk about T4 and T3 because those get confusing. So T4 is actually the pre-hormone. So your body makes it, but it's not active. Then it goes out into your bloodstream, and then it converts over to T3, and T3 is actually the active hormone. T3 is then what goes into your tissues and your organs and asks them to do something. And that something includes metabolism, temperature regulation, and all the things that your thyroid does for your body, which is a lot. So now that you understand all that, let me tell you, I get lots of people who come in and they want me to check all these levels, the TSH, the T4, the T3. They want reverse T3 checked. And here is what you need to know about all those levels. The most accurate level for me to check and see how your thyroid is functioning is your TSH, because it's the one that changes the most frequently and tells me if your pituitary gland is doing its job. Unfortunately, T3 and T4 are affected quite a bit by different medications. They can also be affected by illness. And then they are also bound by protein in your body, which sometimes makes them available or not available to your tissue. So those levels are much less helpful to me as a clinician to tell you what's actually going on with your thyroid gland. Now, sometimes I will check those levels if you're having symptoms of thyroid disease and your TSH looks normal or your TSH is high or low, and I need to get a better clinical picture about what's going on. But the most accurate level is always going to be your TSH. The other thing sometimes that I have patients come in asking to be checked is thyroid antibodies. And these would be tests that will tell me whether or not your own body is attacking your thyroid gland. Now, although this sounds scary and it sounds important to know, it actually does very little to help me as a clinician figure out how to treat you, because really, for the most part, people who have thyroid disease, their thyroid is diseased because your own body has decided to turn against you and has attacked your thyroid. So for the most part, the thyroid antibodies are not super helpful to me as far as what I'm going to do to treat your thyroid problem. I don't mind to check them for people, but they don't really do a lot as far as guiding my treatment. In general, when I'm talking to patients, I talk about trying to keep their costs down, and so I try to not do a lot of extra labs that are not going to help me and guide me in what my treatment plans are. But as always, sometimes if somebody wants a lab done because they want to know, that I'm not opposed to doing that lab. It's just I let them know that it's not really going to change what I'm going to do for them. Now, I'm going to do a separate video about treating your thyroid because there's lots of different things that go into that, and I need to do that separately. So if you have thyroid disease and you like this video, give me a follow over here and share this video, and I'll do another video about treatment.